The DREAMM-9 clinical trial was a phase 1 study that looked at the combination of Belantamab mafodotin with BRD as induction for transplant-ineligible newly diagnosed multiple myeloma patients. There were 8 different cohorts that were examined to look at doses of Belantamab at 1.9, 1.4, and 1 milligram per kilogram given during the induction phase of every 3 weeks or every 6 or even every 9 weeks, and then in the maintenance phase, 6 week, 8 week, and 12 week respectively. And so since the dosing schedules and cohorts were different, we decided to group them for this the purpose of the final analysis into the more frequent dosing, the extended and the longer extended versions. And the key lessons that we learned was that initial frequent dosing is important to get depth of response, but then you start getting into issues with the ocular side effects more frequently. That's why the right probable schedule is going to be 6 to 8 weeks, and then during the maintenance phase, it's probably going to be around 12 weeks. And those are the dosing schedules that are being followed in the frontline DREAMM-10 as well as the pre-COG clinical trials. The depth of response was very impressive for this older myeloma patient population with the median age of 74. Response rates, especially if you look at MRD negativity, for the first 2 cohorts were over 50%, 54 to 56%. They do drop a little bit if you go to Q9 or Q12 week dosing. So those cohorts, you lose efficacy. And that's something that we had highlighted. So, so that's kind of like the gist of it, that in induction, probably, Q6 to 8 week dosing may be better, for maintenance, Q12 week.